Well, good morning, Mrs. Forlenza.
Nice
Mr. Forlenza, it's very nice to see you. Hi, Holly, how are you? So nice to see you. Now, even though Holly's doing well right now, I thought it would be a good idea for us to set up this appointment so that we could develop a care plan for the next year. And I see Holly turns 16 this month.
Yes, she does.
Does she have a transition IEP at school?
Yes, she does. We've been looking at a lot of options of school to work, and I actually brought a copy of it here in our, it's in here, isn't it, Holly? It's in our medical history plan that I bring with us to these appointments.
Yes, well, I think it's very important that we include medical transition in this. I think there's several things coming down the pike that you need to be thinking about now and be proactive about.
That's great. You know, I have been focused on the transition plan we have at school. It never crossed my mind to look at a health transition plan. That's a great point.
Now, when Holly finishes school, has she given some considerations to what she wants to do later? Holly, have you thought about what you want to do when you finish school?
Well, what she's indicated through her PICSIM system is she seems to be really interested in anything that has to do with theater, performance, staging. Wouldn't you agree, honey?
Sure.
Yeah, and I did bring some of the samples with me in her personal medical plan book that we carry with her, so you can see some of that.
Okay, well, I think that sounds like a great idea, and certainly as long as I've known Holly, she's been quite the clown, so I think she'll do quite well there. One thing that you should consider, though, is the issue of health insurance. Now, a lot of times those jobs do not come with significant benefits and all. Have you given some consideration to health insurance when she turns 18?
You know, we really haven't. I just assume since she's on a Medicaid waiver now that would just transfer straight across.
No, she's on through SSI, right?
Yes, she is.
Yeah, well, the eligibility criteria through SSI does change when you turn 18. I know that, but I'm not an authority on it, so I think the best thing to do is to probably put you guys in contact with someone from Family Voices, because I think they can talk to you about that in detail. You know, also as a general rule, this practice doesn't see patients once they turn 18. But I did talk to my partners, and because of Holly's special health care needs, including her seizures and all, they were willing to make an exception. Nonetheless, I think we ought to be thinking somewhere down the line about an adult doctor for Holly, because as she gets older, she's going to be dealing with some health issues that I, as a pediatrician, aren't quite as comfortable with. You know, a lot of things related to women's health and even some of the issues related to cardiovascular risk, and of course some of the medications that she may need to be on I may not be as familiar with, and including some of the dose regimens and stuff. And that may be true for her specialists. Have you had a chance to talk to them?
Well, at her neurology appointment that we had just last month, I did talk to her neurologist, and he said that they typically do see kids after they turn 18. So that's why I just assumed that the pediatric office would also see her. We also did talk to her GI doctor, Dr. Bile, and he's not comfortable maintaining her health care, but he did give us some names of some other doctors that we could call and perhaps go interview, if you will.
Yeah, that doesn't surprise me. Again, the neurologist has training both as a child neurologist and frequently as an adult neurologist. But the pediatric gastroenterologist, just like myself, is more focused on childhood illnesses and all. You know, one of the things I think we can do is, once you identify who the adult gastroenterologist is going to be, we can certainly make sure that he gets a copy of the medical records. I have all the consultation reports that Dr. Bile sent me, although you should have those too. He should have sent you a copy of them.
And then can I keep them in our medical history book as well?
Sure, that's always a good place to do it.
Great, I'm kind of concerned about, as she moves on to more into the community with other peers, are there any different vaccinations or whatnot that I need to think about?
Well, actually, that's a really good point. I think one of the things that we ought to consider for Holly would be the meningococcal vaccine, as she's, high school students and young college students are at a higher risk for meningitis that's caused by this bacteria, and so let me get you some information for you to read about that. Also, you had told me previously that Holly was spending some time volunteering in a child care center, which I think is another great opportunity for her.
Yeah, she likes
You like the kids. But I think because of that, one of the things that we ought to look at is perhaps a hepatitis A vaccine. And also, again, like I said, I'd like to get you some information about that. You can make some decisions, and we can schedule you for a time just to see the nurse and get the vaccines. Okay, well, Mr. Forlenza, you've been quiet.